Looking to use a telephone or audio to conduct your telehealth visit in the state of Texas, it's something that can be doable, but you got to follow the rules and regulations of the law. Here in the state of Texas, Texas physicians and other mid level providers can use remote communication devices like phones and other sources just on the audio to offer telemedicine services. Remember that when you're doing your billing, it's important that you're indicating the type of mechanism and device that you're using, because certain healthcare insurance companies will pay more for more detailed evaluation. As long as the provider is abiding by HIPAA guidelines as far as the audio telemedicine services, yes, it's going to be perfectly acceptable in the state of Texas and really nationally if they're abiding by the law. Again, going back to billing, making sure that you're appropriately billing and letting your payer know what type of evaluation or what type of documentation you can use to support what you're doing. Now, traditional landline phones are not covered by the HIPAA security rules. A provider will need to find a phone that will meet the HIPAA rules and regulations in order to create a secure mechanism for delivering healthcare services. Texas law requires that a valid practitioner relationship is established. As long as you feel, or as long as you can accurately establish a patient relationship with your patient, that's all that really matters. It really goes more into detail when we're talking about, is the phone the right mechanism to do, let's say, evaluation of the patient? Is the phone the right mechanism to dispense prescription drugs when you don't get an opportunity to provide a detailed evaluation of the patient because you can't really see them? So those are going to be the questions that providers will have to wrestle with when deciding what mode and mechanism they can use. But it's also something to think about, and what type of service you're providing. Is it the first evaluation, first time that you're establishing a relationship with the patient? Or are we just having a quick follow-up conversation with the patient, asking them how the medication and treatment that you've already prescribed them working? So those questions are important to determine and decide when you're delivering and offering care to your patients. But certainly, we are here to help you if you're trying to determine what's best for you and your patients and your practice. Reach out to us at dorismeet.com. We'd be happy to help. Thanks so much. Bye.